going to go ahead and get started. Welcome everyone to the webinar on manufacturing and warehousing. I want to thank all of our partners in this endeavor, Parkview Health, the Northeast Indiana Regional Partnership, and the Allen County Department of Health. Special thanks to Dr. Deborah McMahon and Mindy Waldron at the Department of Health for their great leadership through this pandemic. Also Heather Shagler at Parkview and the staff here at GFW and the Regional Partnership. A great deal of time and effort has gone into bringing this series to you. We are proud to be bringing this critical information to our business community. For housekeeping, please hold your questions until the Q&A segment towards the end of the program and include your name in the questions. We will be utilizing the Q&A tab that is located at the bottom of your screen. You will be receiving via email a survey immediately following this webinar. You will also then be receiving an email with the recording and presentation slides for this webinar. Thank you to all the participants for submitting your questions in advance. They served as a guide for the Parkview team to develop the content. While you may not hear your specific question asked, we hope that the information shared will address your most pressing concerns. I'd like to introduce the Parkview participants. We'll be starting with Jo-Lynn Succo, Chief Information Officer. We'll have Dr. Jeffrey Board, Chief Safety and Quality Officer. Dina Jackway, Chief Community and Human Resource Officer. And Dr. Mike Knipp, Total Health Chief Medical Officer. Jo-Lynn, I'll pass it over to you.
Great, thanks, John. So I'm Jo-Lynn Succo, and I have the privilege of serving as the Chief Innovation Officer for Parkview Health. I want to start us off today by saying thank you for all you have done for us, as we have been there for you. Thank you for staying home to slow the spread of COVID. We've really been overwhelmed by the generosity of our community and our region. We've received hundreds of cards for coworkers and patients, distributed thousands of meals donated for our coworkers, and we're moved by the flyover of the 122nd Fighter Wing and the socially distanced prayer vigils held by the community in support of our team's response to this pandemic. We're really humbled by your generosity. I also want to share a little about how we are doing. As you can see on our slide, we have our COVID impact meter, and we are cautious, but we are not in crisis, and we have not been in crisis in the 60 days since our incident command has been open. We are prepared to take care of the needs of our region and have been taking care of our patients throughout the 60 days. We're really beginning to see the number of our hospitalized patients with COVID plateau. And in the last couple of weeks, we're really starting to see patients come back to our emergency rooms. And this is really important because we are seeing some patients who've actually delayed care, and we're here to provide that care. So we are really hopeful. We're spending a lot of time beginning to think about how we begin to safely open up the parts of our organization that we've suspended due to COVID. And we're really thinking about what the world looks like today and how it's different than it was before COVID. As we think about this, there's going to be important considerations that will continue to guide our actions. We're really living in a world now where COVID is just going to be part of the community. We know from the vaccine manufacturers that they will be at least 12 to 18 months away. We expect it will be bumpy as we reopen Northeast Indiana and Parkview Health. We expect some resurgence, and we want to do all that we can do to keep that as low as possible. We're also operating in a world where the information we have is evolving and dynamic. We're implementing safe practices that will help our coworkers, customers, and community. And we know that crises like COVID challenge us to think differently, innovate, and emerge stronger. So We are spending and have spent a lot of time across our operations thinking about how to open in the absolute safest way. As the community, you have been so generous with us, and today we'd like to return that generosity to you by sharing what we are learning and doing. You will learn a little bit more about our free service offerings later in the webinar, but one thing we've done is created a website to share what we have learned and sharing what others are doing in a variety of industries and areas. This is going to be a living document that will change as our situation evolves. We have it full of workplace considerations, people considerations. We've also established a hotline with a one-day turnaround where you can email or call and answer questions from subject matter experts about questions you have. We want to stay in dialogue with you, our community, so that we can all open safely together. With that, I want to turn it over to Dr. Jeff Ford, who will share more about our approaches to how we keep our workplaces safe and take care of our people.
Hello, everybody. It's a privilege to be able to share information with you about our journey and our experience coexisting with COVID-19. And we hope that this information is going to be helpful for you as you reopen in the new normal of coexisting with COVID-19. So what is your workplace like? When we think of place, we want to think about the built environment and those spaces where your coworkers and your customers engage in your line of business. That space may be small, it may be large, it may be configured in different ways depending on the type of work that you do in the industry that you're in. It may also include shared or public spaces depending on the configuration of your building. As Jolynn mentioned, your recovery plan really needs to embrace and understand what the current community level of COVID-19 is. And currently, what we have in the United States and also in Northeast Indiana is that we have what's called community spread. What does that actually mean? What that means is that the source cannot be pinpointed. So if we have a patient that we identify that has signs and symptoms and we test them and they have COVID, it's really not going to be possible to pinpoint where exactly they contracted the virus. The other thing is, because COVID-19 is a novel virus, there is no widespread immunity to infection. And this translates to that everyone has the same risk of acquiring the disease if it's widespread in the community. At this point, we have to be most concerned about those people who, if they become ill, may have serious illness as a result. So older adults, adults that have comorbid conditions or other chronic health conditions may be at more risk for severe illness that would require hospitalization or even possibly ICU level care if they contract COVID-19. This population can have more risk from contracting the illness. When we approach workplace readiness at Parkview Health, we've really embraced this framework, which is called the hierarchy of controls. And this is a fundamental framework that you find in occupational health and safety. And think about it as an inverse pyramid. And at the top of the pyramid, the most effective set of interventions that you can have is elimination of the risk, physically removing the hazard from the workplace. Second is engineering controls, which is isolating people from the hazard. Third is administrative controls, and this is basically changing the way people do their work operationally to mitigate the risk of exposure to the hazard. And finally, the last line of defense is personal protective equipment. This is something that we've heard a lot about, but I think a lot of organizations, as they prepare to reopen, we need to make sure that we're focusing on all of the different levels of the hierarchy and not just the bottom level of personal protective equipment. So as we consider your workplace, walk through that hierarchy of controls. Think about your opportunities to eliminate risk, engineering controls, administrative controls, and then finally personal protective equipment. On the right-hand side of your slide, you can see an example that was just released by the Toyota Safety Plan, where they talked about reconfiguring an office workspace to provide structural social distancing within the office environment. This is an example of embedding the social distancing in the design of the workspace in a manufacturing or warehousing scenario. By repositioning equipment and people, you can increase the level of space, increase the level of safety by creating social distancing in the workplace environment. For meetings, training, and other gatherings, again, we have to think about the new normal and having very explicit changes in the physical environment and in workplace behaviors to maximize the opportunity for safety. That means that for huddles and meetings, having people at least 6 feet apart, spacing out tables if you're in a classroom or a conference room session, and also whenever possible, limiting the number of people gathering in any given space. I want to spend just a little bit of time talking about testing. This is something that is discussed extensively in the media, and often we hear comments such as more testing will help us reopen the economy. It's important to understand the two main types of testing that are currently available and what the uses and limitations are. First is antibody testing. This is useful for population surveillance for past infection. Right now, the Indiana State Department of Health is doing a comprehensive antibody, what's called seroprevalence epidemiologic study, where they are sampling individuals from every county in the state of Indiana to determine what the prevalence of prior COVID-19 infection is. They'll repeat that process on regular intervals over 12 months to really assess the spread of the virus over time, and this can help inform decisions such as population health measures and policy, so that we as a larger community can understand what the current prevalence of COVID might be. However, there are very important limitations. Number one, most important, it is unknown at this time if antibodies are actually protective. So if someone does have a positive antibody titer, at this point, we do not have any evidence to say that they are immune from infection or that they are incapable of spreading the virus to others. The other thing is that the Food and Drug Administration, when they opened up antibody testing, because of the pandemic and because of the desire to get as much testing capability out as quickly as possible, relaxed the testing criteria and regulatory validation steps that would normally be taken for diagnostic testing. This means that there are many tests on the market, most of which have not undergone any scrutiny by the Food and Drug Administration and have not gone through an extensive validation process with a clinical laboratory. So unfortunately, many tests that are currently marketed today are inaccurate or unreliable. As a result, because of these limitations, an antibody test is totally inappropriate for individual employees for return to work decisions. So it should not be used in that manner. Second is the PCR test. This is the test that we use in the hospital or the clinic to diagnose someone that might have COVID-19 that presents with signs and symptoms. The test is most useful in people that have symptoms because it detects the RNA of the virus particles in the back of the throat. However, if a person does not have symptoms, the test is insensitive and can be negative prior to onset of symptoms, even in people that may have early onset disease. The other thing is that all the test tells you is at the moment in time that you collect the swab from the back of the throat, whether or not that person is infectious just at that moment. So a negative COVID PCR test on Monday does not mean that someone couldn't be exposed to become infectious later that same week. Workplace design and preparations. The CDC recommends that all businesses consider improving and looking at engineering controls, including looking at their building and ventilation systems. It's very important through training and ongoing messaging that you support and encourage respiratory etiquette, coughing into your sleeve, for example, using hand hygiene frequently for all employees, customers, and worksite visitors. We also have to think about regular cleaning and disinfecting the work environment and identifying and, where possible, eliminating common high-touch surfaces. So, for example, instead of having one stapler in an office for everybody to use, have multiple staplers so that one object is not being touched by many people if possible. The other thing is it's going to require a change in behavior. People are going to have to get used to regularly cleaning their workspace. So when I come to the Incident Command Center, I'm cleaning my workspace at the beginning of my shift and the end of my shift. I'm cleaning my work surface. I'm cleaning all of my other high-touch surfaces. And you want to look at doing the same on a regular basis throughout the workday to ensure that those high-touch surfaces remain as clean as possible. You can break down your workplace design and preparation into three general categories. One is the always category. This is basically the way we should do things every day as part of the new normal of coexisting with COVID-19. That means social distancing, that means not coming to work sick, that means regular hand hygiene, cleaning work surfaces, using engineering controls whenever possible, supporting remote work for coworkers whenever it is feasible, making sure that they're not coming to work when ill. Additional measures might include modification of staffing if we start to see a big increase in COVID-19 cases within our region. Maximum measures would be the stay-at-home order that may require you to severely curtail or limit certain business activities or even close a location if there is a very high level of activity and there's a government order to shelter in place. What is Parkview doing? We are also using this hierarchy of controls model, and we call it more than a mask. So in every clinical and non-clinical work area, we have provided our leaders and coworkers with this framework so that they can make sure that they have a safe work environment as they return to work. Even though the governor may be lifting shelter-in-place restrictions soon, we have over 4,000 coworkers that are currently working from home. And they're going to continue doing that as long as it's operationally enforced. Because that helps eliminate the risk to those coworkers. So we're continuing to use engineering controls wherever possible. We're doing screening prior to clinical visits to make sure that symptomatic patients are directed to the right areas to minimize risk of exposure to others who may not be ill. We've also implemented engineering controls such as looking at air handlers and negative pressure rooms in many clinical areas. We have erected plexiglass barriers where they're appropriate. We've also put in place many administrative controls in both our clinical and non-clinical areas. And finally, we have extensively trained and provided appropriate personal protective equipment to all of our clinical staff that do direct patient care. And I really want to emphasize the importance of training. So personal protective equipment is only going to be helpful to protect the wearer if it is the right kind of equipment and it is put on and removed correctly. So make sure that if you're using personal protective equipment that you follow professional and industry guidelines, that you're making sure that they have access to the right kind of equipment and they're trained on proper use on how to put on and remove that personal protective equipment. So next, I'm going to turn it over to Dina Jackway, our Chief Community and Human Resources Officer.
Thanks, Dr. Board. Good morning. It's a pleasure to be here with you. When we think about the last 50 to 60 days, I think many of you would agree, a local CEO said that it feels like we're flying a plane and we're trying to fix it at the same time, which I would agree. I think every day we're re-engineering, we're coming up with new ways to do different things. And so today's focus, Dr. Board talked a lot about place and environment. And so I want to take a dive into people. And when we think about people, I'm not only talking about the coworkers that work within the organizations, but also your visitors, also your vendors, your community at large, those customers and everyone, because our world has changed, our organizations have changed, and people and the lives that we are experiencing today have all changed, which impacts everyone. Dr. Board did a great job and highly qualified to talk about the hierarchy of controls. But I want to dive into that it really is, yes, about place, and you can look at those hierarchy of controls, but you can also look at it from the people perspective. And I'll give you a really good example that we ourselves challenged to think more flexibly and have a lot more flexibility than we've had in the past around certain ways we've done things. So a good example of that would be remote workforce. And Dr. Board mentioned we have about 4,500 of our coworkers right now working from home. And I would say that 6-8 months ago, our stance was, well, if we have hourly coworkers, we're certainly not going to have them working from home. How are we possibly going to track productivity? What are we going to do? And now we have 4,500 of our individuals working from home. So I think we had to change quickly. We had to adapt. We had to figure out how to do that. And we didn't have a lot of time to be thinking about it and making sure they had all the equipment that they needed and what work they were going to be doing. So I think that when you walk through the hierarchy, be thinking about it in both the place, but also the people considerations. The CDC has put out a lot of great guidance, and I want to cover a few that I think are worth mentioning for each of you in your businesses. The first is having a workplace coordinator. So I know that some of the businesses today online and listening do not have HR departments. And that's okay, but you want to have a central point. You want to have a central point of contact for that central source of truth. There's so much information out there. People are receiving their information on social media. They're receiving their information on CNN or Fox News, locally, nationally, so many number of ways. And so they're going to have some fears. So have a central coordinator within the workplace that you can centralize communications, that can make sure they're up to date on everything that's changing, because things are changing so rapidly, but that central point is really important. I mentioned it earlier, but having flexibility in your policies and your procedures and the way that you approach things. The things that you've always done may not be able to fit in the new normal and the new environment. And so I think that it's really important to challenge ourselves and what we can do differently. Education. And education is so important because, as I mentioned earlier, people have information that they're receiving, but what they want from an employer standpoint is, what does it mean when I'm here at work? And how do you communicate to them about what their experience will be like as they're, whether it's working from home or whether it is working back in the workplace. And so educating on fears, educating on the clinical side that Dr. Board has talked about, all of that very important. And then consider your social distancing. And when we think about that, that is with our coworkers, that is with our customers, that is with anyone coming into contact with your businesses, and really think about those that are vulnerable. And that there might be individuals that need to have accommodations made because perhaps they have underlying health conditions. And so they may have to ask for some very specific accommodations. Just simply have a process in place so that you can, not that you have to accommodate everything, but that you do need a process to make sure that your coworkers can access a way to raise their concerns and needs for accommodation. On the staffing side, really want to look at how we can rebuild and be very flexible around staffing. And I think part of that is we understand internally in an organization, it may mean that people are asked to be doing different roles, things that maybe they've not done before, but now because of social distancing guidelines or because of any organizational guidelines, we have to have them do their work differently. So it might be different shifts, it might be different hours, it might be in different locations, it could be an entirely different role for a while that is different. We've deployed individuals from different roles. Athletic trainers are a really good example. So our athletic trainers aren't in the schools and working. And so we redeployed them to other areas, such as within nursing units or within business areas that they can provide additional support to the care team. So they're being asked to do very different things. On the external side, as I mentioned earlier, as the world has changed and of course digital learning is now a reality for providing education to our youth, we also have to be flexible on just being able to accommodate coworkers who have children at home, that perhaps they were able to work during the day before because their children were in school and now, or in childcare, and now that is a reality for them that they don't have that additional assistance and backup care. So, and we'll talk a little bit later about some of the things that Parkview has done, but childcare is definitely a real challenge for many of these coworkers. Finally, I would say, what are you going to keep that in this time of change and turmoil, but we've also found some incredible processes. And I think that's a great lesson learned for us is there's some things that we have started in the last 50 to 60 days that we look at and say, well, why weren't we doing this all along? So that is really something to step back and look at the end of all of this and say, what do you want to keep? What do you want to keep doing because it's worked really well? I want to share with you a little bit about our returning business support coworkers. As we mentioned earlier, we have about 4,500 individuals who are working from home right now. But we've been very clear that when the governor announces whatever he's going to announce on Friday of lifting or phasing in the stay-at-home order, we've instructed all of our 4,500 coworkers that are working from home to continue to do so. We want to be very thoughtful about how we phase individuals in, how we look at first, what is the prevalence of COVID in our community and what is that rate of hospitalizations, and going back to that impact meter that Jolynn talked about earlier, are we in a cautious state or a crisis state? And as that meter changes, we'll reevaluate who we want to bring back and when. But I think the key point, and this particular slide and a few others will be out on our website that Jolynn mentioned for your view and use, but the whole point is not bringing everyone back at the same time. And for us, we've chosen 25% at a time of those 4,500 individuals, and there's no time frame on it. I think we're looking at a 12 to perhaps 18-month period of time. And so this isn't weeks, this is months and months of bringing individuals back and stair-stepping that work. And so trying again to be very flexible with what the environment is dictating. When we also look at how we're bringing individuals back, and so for some of you, as you're thinking about if you have a cohort at home and who you're going to bring back and when, I think it's a couple of considerations to think about. Are there people who want to come back? Are there people who have childcare and they don't need, and that's not a barrier for them? So bringing them back first. Are there certain roles that you find more important at the time that you need it, or different positions that you might say, I want to bring them back first, or a diverse group of coworkers? All food for thought, certainly very adaptable to whatever needs that you have. We just wanted to provide some thought-provoking ideas as you're bringing individuals back into the workplace. And then the return to work process. And it's a little different than those returning who are remotely working now. Our return to work process is really all about those who are ill and coming back into work. And I would say a big lesson learned for us, and certainly want to share this practice with you, is we started off by having many of our leaders across the organization be the point of contact for their department coworkers. And what happened is that because CDC and national and local guidance is changing so fast, the leaders were not able to keep up. And so one conversation could look very different from one returning coworker to another. And we felt like that just wasn't helping our entire team. And so what we decided to do was create a hotline so that any leader who needs some guidance, or any coworker who needs guidance because they're ill and they're returning to work, can call into this central number and be able to get the most current information and guidance as to how to return to work safely. And that has been a great tool for us. And so it's something for you certainly to consider if that would work in your workplace. Now I want to shift a little bit to just giving you a few ideas of what Parkview has done and the things that we've seen success in as we've gone through the last 50, 60 days. The first around the people. And I believe firmly that people are the most valuable resource in an organization. And because of that, when we think about everyone's needs, there's not a one size fits all here. So everyone has different needs. So we started off by asking. We asked individuals, what do you need? What are your biggest barriers right now? So that we could help them, not only from an organization standpoint, but obviously helping them within their personal lives and the barriers that they were experiencing. So asking them, it seems very simple, but highly effective to hear the voice of your coworker and understand what they're dealing with. So we flexed benefits. We allowed people to go into the negative on their PTO. We opened up different frozen benefits that were for a very specific instance and a very specific use for a coworker, we opened that up and said, hey, you can use that now for any absence that you need related to COVID. Or perhaps our leave of absence policy, some of them are for the coworker only, and we opened that up for family benefits as well. So just, again, being very flexible, because we know that everyone is needing things a little different right now. And then, of course, on the attendance policy, we have said we absolutely understand right now we have a job to do and we have people to take care of, but we also understand that not everyone can be here right now. Connecting necessities. When we asked our coworkers what they needed, and I think back to the time where toilet paper was definitely a scarcity, and asking our coworkers what they needed, and those that were quarantined or those that were on a leave of absence and they couldn't get out and get the things that they needed, or frankly, those that were here, you know, many hours in a day and weren't able to get the supplies they needed for their families. So we did a lot of helping. We delivered, whether it was food or supplies, to our coworkers. We delivered in things that people needed but didn't have the time to go and get. And I firmly believe that how we're treating our coworkers now through times of crisis is really going to be important when it comes to when we're through this. And I use, you know, through this in air quotes because we don't quite know what the end looks like, or if there is an end. But treating coworkers with respect and dignity is really important through this. And then childcare. We talked a little bit about this earlier, but I'll dive a little further in. So helping individuals with childcare can be as simple as we connected with care.com on a national basis to help individuals get connected to emergency backup care, not only for their children, but for those taking care of elderly parents and perhaps some elder care needs that they had. We created a Facebook page and Facebook groups so that high school students and college students could offer their services and connect it up with our coworkers who needed care. Something very simple and just organically took care of itself when you get all of those people together in the group. So I won't go into great detail. We can certainly talk with you much more about your specific needs. And then finally, I'll end with mental health. And we cannot underscore the importance right now of everyone going through their own journey. And mental health is very real, especially when we talk about our coworkers at home and they're isolated and they might live alone. And so they're feeling alone and they need that connection. So what you're doing for coworkers and even those coming to work who have fears, I think we need to acknowledge that coworkers are going to have fears, and as much information as we can be providing them, that central source, as I mentioned earlier, so important. One simple thing that we did was Calm. Calm app is an app that is available, and we provided a 6-month subscription to all of our coworkers. We said, this is an app for you, no matter if you're at home or you're here at work, helping with breathing techniques, helping with just being able to sleep better, being able to go through all kinds of curriculum or journeys to help individuals through. And that has proven to be, we've heard so many coworkers comment that it's been helpful for not only them, but their family. So thinking about mental health. And then we also really look at our EAP program, and we have challenged and worked really closely with our EAP to offer lots of different virtual services to not only individuals, but to groups of individuals who are similarly situated. Our leaders having groups together, or coworkers who are providing care to perhaps COVID patients all together because they're all in that same, they're experiencing some of the same feelings. So please, we really encourage you to think about the mental health of your coworkers as we're bringing everyone back and as we're recovering. I'm going to turn it over now to Dr. Nip. Thank you.
All right, thank you, Dina. Hi, Dr. Mike Nip here. I wanted to spend a little bit of time with a couple specific insights for the industry folks we have here, kind of from the occupational health, occupational medicine world. So again, you're going to see here on the right side, the green chart with the hierarchy of controls. I want to spend a little more time there on your left with the orange section. So what we want to do are a couple things. We want to try to find as high up on that hierarchy as we can with a solution. We also want to make these solutions as simple as possible so your employee and patron can make the optimally safe and healthy choice. I want to call it a couple things, specific areas that you need to think of, maybe you haven't. This is like your break room. What are people touching? High touch areas like a refrigerator handle, a coffee pot, a vending machine, something like that. You want to also find your own experts. These people are your end users every day that are in your workspace that may have a solution you have not thought of. They don't need a PhD to untie that Gordian knot to get your solution found for you. And I also am stressing to employers when we chat, you want to be very open with both your employees and your public. You are the experts on creating your employees and your customers' experience, but you want to let them know, what have you done to optimize their health and their safety? Is this signage that's on your entry point to say, hey, here are the extra things we're doing to protect you? I've seen a lot of good solutions come up that way and a lot of engagement through that. So just another slide here from the Toyota example. So you see the different areas up there. We've talked about a couple of these. This is more in kind of the human interaction space, not necessarily their manufacturing line. What they do, as you can see there, is they're trying to recommend the most effective solution you can. So obviously we try to look at an elimination strategy first, but sometimes that is not going to be an option. If you have to move down that rung on the hierarchy, what is the next thing that you can do to optimally protect the safety and health for that specific area or specific process that your folks are going to be encountering? So again, here's another slide from that Toyota document, which just highlights a couple areas you might not be thinking about yet, but which are going to be important. One solution we've been talking about a little bit, just in your restroom, how do you make the safe and healthy choice and the optimal choice easy? This is even bringing that trash can closer to that exit door, because that exit handle is going to be a high touch area. So the person can, finish washing their hands, grab that paper towel, and they can keep it in their hand, place it around the handle, open their door, put that in the trash receptacle there right by the door, and they've reduced, or they've really kind of eliminated having to touch that high touch area there. So here is a preview of a website Jolene's going to talk about a little bit more, but here are some industry specific resources that we'd like to connect you to. If you go there, you're seeing some of these familiar words like CDC and OSHA. While we're here, I wanted to take just a brief second to call it a couple things for our manufacturing partners. The specific things are OSHA standards. Many of you may be wondering, how do we stay compliant with an OSHA standard, specifically if it's a chromium, a lead, a respiratory protection, or a hearing conservation. So I wanted to direct everybody to, when they can, OSHA has a COVID site, which they have put out a couple memos recently, which are very accommodating to the realization that employers may not be able to complete all of the required services. For example, annual audiograms, annual spirometry. Our practice itself has been has had those suspended for a little bit because of recommendations regarding from the specialty colleges on that. Just to briefly nutshell this, it's still wanting employers to make as good faith effort as they can in this time to meet those, knowing that they may not be able to, but as soon as the opportunities to meet those standards again, to do so. The other thing I wanted to mention too, manufacturing obviously has to get its stuff, as it were, to places that need the stuff. So logistics. I wanted to just briefly touch on commercial motor vehicle drivers, because many of you will have a commercial driver corps. The FMCSA came out about a month ago, March 24th-ish, and talked about a kind of a waiver or grace period, if you will, for drivers, CMD drivers, who their certificate may be expiring, because as we know, the accessibility and availability of getting those DOT exams done, that has decreased along with other routine services. So FMCSA memo on expiring cards, I encourage you to Google that, but in a nutshell again, through June 30th, if you had a current card before March 1st, you're going to expire in that March 1 to June 30 period. There is in as much as a quasi waiver or grace period. I do want also folks to call out and look at their specific state site because some states in our region here, Ohio and Indiana, are approaching it just a little bit differently on how long they're going to recognize that waiver. So please reach out to that website, take a look, and also reach out to your local health practice. Now I'm going to turn it back to Jolynn here for a little bit more information on how we can help.
Thanks, Dr. Nip. So I am really excited to share with you Parkview Business Connect. As we continue to operate in a pandemic, Parkview really wants to help leaders to lead. This is a free resource that we're offering that has a website and some other services. Many of you think of us as just healthcare, but we're actually the largest employer in the region. So we operate 10 cafes. We have a police force. We have extensive grounds crews, office areas, and frontline areas. So we're really learning every day in all of our settings. The dynamics of this pandemic are changing rapidly, which means that our responses and our services are going to change as well. And again, these are free to use. So first services, coaching. We have a hotline called Parkview Business Connect, and it's on that green button in the you can see the number. It's 266 Connect or 260 Connect. We have a website that's chock full of great information, and we're evolving the website daily. We're sharing also best practices from all of the sectors, so Toyota, CICP, and we're going to continue to evolve it with the questions that you have. So with that, I think we're ready for Q&A. John?
Jolynn, thank you very much, and thanks to all the Parkview team for providing the information that you did. Let's go ahead. The Q&A tab is open. We have a few questions that we're going to cover that were already submitted. We could maybe go to the first question. The first question is, should I require all my employees to wear a mask while they're at work? And if so, what kind?
This is Jeff Ward. This is a great question, and it's really going to go back to that hierarchy of controls framework that we talked about earlier. So if you have a workplace where you have the space and you can configure the work area where people can have a wide degree of social distancing, masking is less critical. But if you have a workplace where that's really not feasible, masking may have more of a role. It's important to understand that cloth face coverings that have been recommended by the Centers for Disease Control for use in public areas where you cannot easily maintain social distancing are for what's called source control. So that's where I wear the mask to protect everyone around me in case I might harbor the virus and not yet have symptoms. So it's a different application than what we think about traditionally for personal protective equipment, such as wearing a respirator when I am dealing with a hazardous chemical or fumes, where the goal of the personal protective equipment is to protect the wearer. So just important to think about those considerations. And I think that there's not a one-size-fits-all rule. It has to be individualized to the workspace and not just the location, but what the workers are doing and what other steps you can take to mitigate the hazards.
Well said, Dr. Ward. I just wanted to add, this is Dr. Nip again, one reiteration point as we are discussing with our manufacturing partners. Obviously, use whatever is required to meet your standard as well. This could be still an N95 or a half face or a full face mask, depending on if there's a specific chemical or substance that you're working with.
Okay, the next question, how do I make sure my employees are virus-free when they come to work? Should I be doing temperature checks at the start of every shift?
This is a great question. As I mentioned earlier, we're in a situation where we have community spread of the virus. So you really cannot effectively exclude people. We don't have a technology or process that can effectively, with 100% certainty, exclude people who might be harboring the virus and don't know it. So unfortunately, temperature checks are very insensitive. So although these are being done in a variety of locations, there are some challenges with it. One is that we know from prior medical published studies of COVID-19 infections that patients, for example, presenting to the emergency department or hospital that get admitted with COVID-19, less than half actually had a fever at the time they presented with their illness. So fever is not a reliable early indicator of possible early infection. So it's very insensitive as a screening tool. We do want to emphasize the importance of being sure to clearly communicate to your employees to not come to work if they think they may be sick. Make sure that they have clear instructions on what to do if they have symptoms. So who do they call if they are going to report symptoms? And to have those policies and procedures in place so it makes it easy for people to stay home and self-isolate if they have new onset illness to mitigate the risk of exposure to your coworkers. So I'm going to turn over to Dr. Nip for some additional comments as well.
Thanks, Dr. Board. So what I've been trying to communicate to employers on temperature screening, Dr. Board did the science very well. It's a deceptively small pebble that is going to cause a lot of ripples you may not be aware of. A temperature is a vital sign. This is protected health information that has to be used appropriately. This is a practice, if you do it, that has to be done consistently for everyone. If it's the owner, CEO, president, or it's someone is their first day on the job, everyone has to have the same treatment. The EEOC did come out and say about a month ago, this could be something you could do. But again, what happens if someone has a fever? It has to be documented if you're going to make a stay at work or not come to work decision. It's just like I was saying, it's if it has to be done based on an industry or state or regulatory requirement, it can be, but there's just a lot of front loading to figure out how you're going to manage it.
Agree. And from a clinical perspective, again, many patients who have early symptoms of COVID-19 will not have a fever early on. And so if at Parkview Health, if we were to have a coworker come to work and say, gee, you know, I have cough, I have shortness of breath, I have other symptoms, but I don't have a fever, I would still recommend they be sent home and self-isolate and get a clinical evaluation, even if they didn't have a fever.
I agree. One other point, sorry, Dr. Board. I think, you know, I will say on this point too, the CDC just released last week another 6 or 7 symptoms. And so that has been another topic. I think we've been chatting, we're still focusing on fever because that means something's going on with that individual. A cough is the functional symptom to focus on because that is how, again, with really many diseases pre-COVID and now especially with COVID, that's how it spread. So I agree.
So that's a good lead into our next question. Let's say one of my employees tests positive for COVID. Should I test everyone at work? And then I guess a follow-up to that somebody has asked, how long should we expect test results to take?
Well, as far as return to work, so generally speaking, that's going to be based on the symptoms for people return to work. So there, Dr. Nip can speak to this in more detail. But the short answer is that routine testing of asymptomatic adults is generally not recommended. And the reason is because, as I mentioned earlier, that PCR test relies on shedding of virus. And when people have no symptoms, they're shedding little or no virus in that upper respiratory area in the back of the throat. And so the test is likely to be a false negative. So it just doesn't really help you make a good decision about return to work. The other thing to think about is that what's the exposure, and that can be kind of hard to pick apart. If you have community-based spread, you don't really know, was the exposure at the workplace, was it not at the workplace? So I'm going to turn over to Dr. Knipp for some additional comments.
Sure, those are good points, Dr. Board. I think so the CDC has put out two strategies. One is a test-based return to work, one is a symptom-based. I think what we've realized very quickly is availability of testing, like has been said, is not a factor we've been able to utilize primarily. So symptom-based wise, this is, again, if asymptomatic folks were normally saying remain at work, watch, self-monitor for symptoms for about 14 days, fever, cough, things like that. If they do develop those symptoms, Dr. Board was talking about a fever or cough, we're calling it kind of the 772, which is from CDC. So 7 days from onset of those symptoms, and we want them to have been 72 hours fever-free and not using a medicine to reduce fever like a Tylenol or an ibuprofen. Cough is a little bit more of a pickle in as much as, the cough doesn't have to be gone. It's also difficult in the season of allergies right now, but we at least look for improvement. And then if you already have everyone has to wear a mask, you kind of already have this solved. But if you don't, we're asking someone to wear a mask until that cough is fully resolved as they're coming back into the workplace.
Exactly, and that's what, again, we call source control. And that really helps mitigate the risk of infecting others outside of the person wearing the mask. And regarding the question about when can I expect to get test results? So if I have symptoms, I go to a clinic or I go to one of the new testing centers being set up. For example, here in Allen County, the Allen County Health Department is going to begin essentially drive-through testing for symptomatic individuals. Generally, expect those results back in around 2 to 3 days. At Parkview Health, for the majority of our testing, we use a commercial laboratory, and the turnaround time averages are right around 3 days for those results to become available under most circumstances. But that's going to vary somewhat depending on which clinic you go to and which laboratory is processing the specimen.
One of the questions that has been asked is, should we restrict visitor access to our buildings? And if so, what can we do to limit this?
Sure. Great question. The short answer is, I think whenever it's from an operational and from a business perspective feasible, I think this is a good strategy. This is that elimination, right? So if you don't have people in the building that don't need to be there, it greatly mitigates your risk of spread. You have to look also at the physical layout of the building. So you may have to restrict and channel people to specific entrances. Obviously, you have to follow all of the local and state codes regarding, emergency exits, et cetera. But by controlling the entrances, we've done this at our hospitals and other health facilities. We control the entrances. We make sure that we've very much greatly restricted visitation because, again, we have ill people who have COVID-19 or are being evaluated for COVID-19 in our hospitals. So to mitigate the risk of exposure to others, we have very significant visitor restrictions in place, as do other hospitals in our region. So visitor restrictions, I think, are an important part of the engineering controls that you can do, just like working from home, just like doing virtual meetings, virtual health. So one of the things we do to mitigate risk is we have massively ramped up virtual health instead of doing in-person clinic visits. So you need to communicate to your vendors, to product representatives, visitors, customers, and clients if you're doing this, and also have a procedure to control traffic entering the building so that you can help maintain social distancing for those people that do have to come in, and make sure that they're aware of things like hand hygiene and cough etiquette, and whether or not you might have a masking program in place for your facility.
Thanks, Doctor. I'm not sure if we have another slide up, or we'll start to go to some of the others that have come in over the Q&A piece. I'll go to one that came in on the Q&A. We're finding a hard time finding some of the supplies that are limited to purchase. Any suggestions on on the cleaning supply aspect. And that probably goes to the personal protective equipment side as well with masks.
Well, this is a challenging issue. I think this is something that we can provide more information perhaps through Greater Fort Wayne. Right now we're looking at, there are a number of local companies that have started producing things like cloth masks. And I believe that Greater Fort Wayne and other agencies are looking at trying to accumulate where those local businesses are that you can source cloth masks and other types of personal protective equipment if you can't find them through your standard vendors and commercial channels.
I will add into that. We are at Greater Fort Wayne Inc. We are talking to a number of local suppliers that are starting to produce masks. We're also trying to aggregate data on other national sources on the mask side, and we will be getting that out on our resource hub on our webpage. So we will be we'll be doing that as well. We're also starting to have conversation with the state on what the governor's task force will be doing as far as rolling out the federal funds that came through the state, and we're hopeful that that will help through this piece as well. And more information will follow on that. We'll continue to follow the progress and make sure that any information we have, we get out to folks through our COVID response page. And there is a piece there on the mask side, so that's a good link for that. One of the questions that came in was, how do you handle employees who are upset about adhering to new policies like personal safety or cleaning their areas? That's probably a good HR question. And I know a number of maybe firms on here may not have HR departments. Any guidance on that aspect?
Yes, this is Dina. Absolutely. This question, not only have we, of course, worked through, but many organizations are working through right now. So my first comment would be, we understand that a lot is changing. I mean, this is a classic who moved my cheese situation where a lot is changing and a lot is changing fast and quickly. And so we need some flexibility to provide to our coworkers, but we also need them to give us some flexibility. And so this is where that central point of contact and how much we can educate and help individuals understand the why behind it, I think is really important. At the end of the day, though, you may have individuals who just don't want to comply. And if we can't accommodate and if we can't provide them a way to do their role in a way that is satisfactory for them and us as an organization, then it may be time to part ways. Certainly not encouraging that, but you've got to try understanding and grace and working through and understanding the why from their perspective as well as the organizations. And hopefully in many of the cases that we've had that are similar to this, we can find a solution that accommodates everyone and where they are right now in their journey of working through COVID personally themselves.
I would add two thoughts. One is, as Dina said, it's really important about how you message this and understanding why. The why is really about the safety of the coworkers and those that they interact with, right? Their fellow coworkers, their customers, visitors to your facility. So why do we obey traffic laws and wear seatbelts? We do it because of the safety of ourselves and for the safety of others. And so really helping people understand these are not arbitrary rules and burdens. These are things to keep you and others around you safe. The other thing is inviting them to help co-create solutions. So if they have an idea of a better way to use that hierarchy of controls framework to keep people safe, that people can benefit from, by engaging them in that process, you're helping them maintain that safe work environment, and that can help overcome some of the barriers that you might face.
How about the kind of the return to work process? What procedures do employers need to follow for the return to work? Do they need a doctor's note? I know you mentioned the 772. Any other guidance on that?
Hi, Dr. Knipp. So this is a, no pun intended, hot topic. Basically employers, there's 3 steps. So there's a remain or come to work decision for the coworker. The employee also needs an interim clinical guidance. What do I do if I'm ill? And then of course the return to work. So again, access is what it is. Like I think's been mentioned, there are a lot more virtual options for care and kind of what we might be used to say, hey, I was off because I had surgery on my knee. I need a doctor note to come back. Many employers are not requiring that note to come back. It's okay to get that. I know we've seen return to work folks where they haven't, but then at Occ Health, we're going to go, of course, do a clinical assessment and work with that patient to see have they met a 772 criterion or something like that. Again, at the core is just communication and partnership between the employer and employee to ensure for both they are healthy and safe to come back to work. This is a larger discussion, but it's just, decide who is safe to remain at work, make sure we're getting them the care in between, and then making sure they are meeting whatever criterion we have to know that they are safe and healthy to come back. Knowing that care options might be different than they have been before.
Obviously, we're talking to manufacturers and people in the warehousing, and you mentioned logistics earlier. How do you safely handle materials that flow through those logistics channels, maybe down the items going down the assembly line? Do you disinfect during the process as they move from person to person? Any thoughts on that?
So I'll take a quick stab. I've tried to keep up, I think Dr. Board as well, with the studies coming out. How long does this virus live? Paper, steel, plastic. We do know a couple things that, going back to, we could say, let's spray disinfectant on every package that comes down the line. We also could take a hopefully simpler strategy of everyone has gloves available to them. So it's not their hands directly touching the package. We have to, again, trying to make the simple, the optimally healthy and safe choice simple, having gloves available, maybe having signage that reminds, hey, wear gloves, don't touch your face, because if you wear gloves, touch the product, and then you touch your face, well, you've kind of lost that aegis of protection that the gloves afforded you. Things as well, the basic CDC things, the hand sanitizer being available where soap and water aren't readily available, because we know these folks that are on production lines for extended amounts of times, they can't break every 5 minutes to go wash their hands, but it's making gloves available, hand sanitizer available, paper towels with trash receptacles, because as we know, we wear a pair of disposable vinyl or other gloves. And for a while, our hands are going to get sweaty, and then if we're going to put them back on, we want to be able to don those appropriately. And again, just to touch for a second, latex is not, I guess, super common, but to make sure you have, I would just probably say nitrile vinyl or easier solution, so you don't even have to think about a latex sensitivity in your workforce.
So a lot of this really comes down to kind of the simple hygiene side. Don't touch your face before washing your hands.
Yeah, and that's a lot easier to implement than trying to somehow decontaminate material that is coming into or going out of your facility. And, frankly, also, again, it's way simpler. It's going to be more effective. And when you think about the amount of operational complexity and cost to try to decontaminate any particular surface when you're dealing with packaging and materials, it's kind of overwhelming. So using those sort of administrative controls, hand hygiene is more likely to be an effective solution.
So one last question. I know we're a little bit over the 1 hour mark. What issues do we open up in varying from company policies versus future policies? Do we set up precedents that will lead to employee issues kind of moving into the future?
Yes, this is Dina. I'll take that one. I think that right now, as I said in the beginning of my remarks, I know it feels like you're flying a plane and trying to fix it at the same time. The same thing comes true when it comes to what policies and procedures are in place right now. Everything needs to be very flexible. I do not believe that you're setting yourself up for something great. Everyone's doing this right now. So you're not alone in the fact that you're going to deviate from something you've always done, and perhaps you might find a best practice in some of the new ways you're doing things. But it's not necessarily setting you up for additional risk or a precedence in the future. You can always adjust things, and you might even adjust to something that's not what you're doing in this COVID time and may not revert back to what you had originally. It could be a hybrid. So I think all things should be on the table right now, and not feel as though you have to follow it exactly to the T the way it's written today.
And to add to that, communication is absolutely critical. So one of the huge values we have recognized from having our incident command center infrastructure is we ramped up communication massively to our leaders, to our frontline coworkers. We set up a dedicated in-house web page to provide, literally real-time updates on any new policy or practices around safety, use of personal protective equipment, visitation, all of these things. And we make every effort to get this information, because it changes regularly, out to the front line as quickly and as transparently as possible so that people are in the know. It's when people are not given clarity and guidance that often is what leads to confusion and difficulty. So I think that over communicating really helps mitigate that risk.
Well, I want to thank all of our presenters today. I want to thank all the participants that were on the call. I want to thank our partners, Parkview Health, the Northeast Indiana Regional Partnership, and the Allen County Department of Health. I think this has been a great session, and hopefully we've gotten information out to employers that can help them through this process. Again, if you have additional questions, parkview.com/businessconnect is a website that's available for you to ask those questions, and the Parkview team will get answers back on those. We will continue to have information on our COVID response hub on gfwinc.com for information. As we get information on whether it be cleaning supplies, masks, etc., we will continue to get that information out there. I want to thank you for joining us today. This was the first in a series of webinars for different industries. So a reminder, you will get a survey email following this. You will also get an email with a copy of the recording and the slide deck. So if there's any questions, please continue to reach out to us, and we look forward to being here to help you through this process. Have a good day.